With heart attacks, every minute counts. Too many people die because they take too long to call 000 for an ambulance. A heart attack can happen to anybody, no matter how old you are. It is one of the most likely things that could happen to you, a family member, someone close to you, or even to a passing stranger. This program will help you be prepared and know the warning signs of a heart attack and what to do. Your life, or the life of a friend or a family member, may depend on it. Why? Because heart attacks aren't what you think. A heart attack is not always sudden and severe like you see in the movies. It can start slowly and get progressively worse. Sometimes it might feel like muscular pain or indigestion or even the start of the flu. You might have just one warning sign or a combination of warning signs, like Eliza. Eliza had been gardening all day when she started to feel discomfort in her shoulder and arm. At first she wondered if it was from doing too much in the garden. She stopped what she was doing and had a rest. But she started to feel worse. Her arm felt heavy and the pain was spreading. She now also had a dull pain in her back between her shoulder blades, and she was feeling like she was going to be sick. She wasn't sure exactly what it was, but she knew she didn't feel quite right, and the pain was getting worse. So she called 000 and asked for an ambulance. She stayed on the phone and waited for the operator's instructions.
Ambulance, please.
Eliza did the right thing, even if you're not sure. If you have pain or discomfort in the chest, neck, jaw, arms, shoulders or back, or if you feel nauseous, dizzy, short of breath, or break out into a cold sweat, stop what you're doing and rest. Talk to someone about how you feel, and if the symptoms are severe, getting worse, or have lasted more than 10 minutes, call 000 and ask for an ambulance. A heart attack occurs when an artery on the surface of your heart is blocked and stops oxygen getting to that part of the heart muscle. As a result, the heart muscle begins to die. The longer the blockage is left untreated, the more your heart muscle is damaged. This damage is permanent. Your recovery from a heart attack and how it affects your long-term health depends on how much heart muscle is damaged. Getting to hospital quickly can reduce this damage, so the sooner you recognise the warning signs and get treatment, the better. No two heart attacks are the same. The warning signs can be different for every person. Although chest pain or discomfort is the most common symptom of a heart attack, some people experience no chest pain at all, while others experience only very mild chest pain or discomfort. George was at work and was taking a coffee break when he felt some tightness in his chest, like a belt being tightened around it. His work colleague Marie noticed his face was a little grey and he looked unwell. She asked if he was okay. He told her that his chest was feeling heavy. She asked him exactly what the pain felt like and if it was getting worse. He said it felt a bit like bad indigestion that was moving up into his neck, and he was starting to sweat. She told him to sit down and rest, but George didn't want to make a fuss. But then, after 10 minutes, he began to feel short of breath and dizzy.
How are you feeling now, George?
Still feeling pain here. Can't breathe.
So Marie called 000. Marie asked for an ambulance and waited for the operator. She spoke with the operator and followed their instructions. The warning signs of heart attack can vary, like with Eliza and George. It's quite common to experience a combination of symptoms. If you have any of these warning signs, stop and rest. Tell someone how you feel. Ask yourself, are the symptoms severe? Are they getting worse? Have they lasted more than 10 minutes? If you're with a person having a heart attack, ask them these same questions and help them out. If your symptoms are severe or getting worse quickly, don't wait 10 minutes. Call 000 immediately. Even if you're unsure, call 000. Paramedics can start early treatment for a heart attack in the ambulance. Remember, it's always better to go to hospital and be told that you're not having a heart attack rather than stay at home until it's too late. Remember, a heart attack can happen at any time, and the longer you leave it, the worse the damage. So be prepared. Know the warning signs of a heart attack and what to do. Keep an action plan ready, perhaps on the fridge, in your purse or your wallet. Talk to your family and friends about the warning signs of heart attack. Don't keep the life-saving information to yourself. Get your action plan from heartattackfacts.org.au or call the Heart Foundation on 1300 36 27 87. Your life or the life of a family member or friend may depend on it. If you're male and you're 40 and you live in Australia, the chances of you having a heart attack by the age of 70 is 1 in 2. If you're a female of the same age, it is 1 in 3. If you're a female and smoke, the odds are the same as the males. As well as knowing the warning signs, there are steps you can take to reduce your risk of having a heart attack. Take your medicines as prescribed by your doctor. Be smoke-free. Enjoy healthy eating. Be physically active. Control your blood pressure and cholesterol. Achieve and maintain a healthy weight. Maintain your psychological and social health. And if you've already had a heart attack, participate in a cardiac rehabilitation program.